Our presentation this evening is on incontinence, and for this we have healthcare professional Deborah Pinter. Deborah is a well-regarded registered nurse with 20 years of clinical nursing practice in Calgary. She's provided specialized nursing care to chronic and critically ill adult patients and their families in intensive care, renal and cardiac critical care units. A highly energetic and caring individual, she is much respected by both patients, families, and colleagues. Deborah is passionate in promoting family health and well-being. Using her nursing experience and passion, Deborah has now launched a company to assess the needs of incontinent infants, children, and adults, and seniors, and to provide quality education and products which would meet client and family needs and ensure dignity and enhancement of health and well-being. Providing assistance to clients and families in managing self-care has been paramount throughout Deborah's nursing career. A native Calgarian, Deborah has a Bachelor of Nursing and Master of Continuing Education degree from the University of Calgary and has experience in clinical information systems. She's married to Ted and they have 2 young children. Talise and Keegan. Personal activities include family life, gardening, yoga, and cross-country skiing. I ask everyone to give a warm welcome to Deborah.
Hi.
You're wired in?
Yeah, I think I'm wired in.
That's just for the...
Oh, so we need to use this too?
You'd still need to use that.
Okay.
Thanks.
All right, well, thanks, Jason. Closer? Okay. So tonight's discussion will be on urinary incontinence, and as Jason said, closer yet? Okay. I am a registered nurse. We will be going through, actually, if you flip the slide, I can talk a bit about the agenda for the presentation. So we're going to be going through a few things. Urinary incontinence defined, normal bladder functioning, causes of urinary incontinence in men, prostate cancer treatment, and urinary incontinence. So, you know, getting urinary incontinence from treatments that come with prostate cancer. If you have urinary incontinence, what is the treatment of urinary incontinence? Little discussion around it does get better. Okay, and we probably have lots of experience here in the room that we can draw upon, and we can, it's an open discussion, so if anybody has anything to add, please feel free to add your comments or your feedback. And then I'll explain a little bit about my company and what we do, and also about the Dribble Stop company and what they do, okay? All right, so next slide. So urinary incontinence defined. Urinary incontinence is the accidental leakage of urine. There's 4 types of urinary incontinence. You have stress, urge, overflow, and mixed incontinence. Stress incontinence usually happens mostly in women, but it can happen with men after surgery. And really what it is your pelvic floor, which are the muscles underneath of your bladder, become weak. And so when you laugh, when you lift things, when you cough, or when you sneeze, you're going to feel a release of urine, okay? Because it can't support your bladder. And so there's a gush of urine. Urge incontinence is an involuntary loss of urine, and it's like an overwhelming need. You have to all of a sudden go to the bathroom, you rush to the bathroom, but you can't quite make it, so you have a leakage of urine. Overflow is primarily related to prostate enlargement, and what it is, it's an obstruction of urine resulting in the constant dribbling of urine. So when you have your urethra, and when we talk about the normal bladder functioning, we can get more into this, but you have your urethra, which urine flows out of. If that becomes obstructed, you don't get urine out properly, so you'll get some dribbling, okay? And then there's mixed incontinence, which is a combination of any one of the above. So you can have stress and urge, you can have overflow and urge, and that's mixed. Okay. So normal bladder functioning. Normal bladder functioning is a combination of brain activity and bladder activity. And what happens is your bladder starts to get full. So you collect urine in your bladder, it sends messages up to your brain and it says, okay, it's time to go to the bathroom. Off you go to the bathroom. When you're going to the bathroom, your brain sends messages back down to your bladder to say, okay, relax all the muscles so urine can be released. It's a constant activity back and forth of this brain bladder functioning. when you look at other things for normal bladder functioning, really important, here's your urethra there. This is your pelvic floor, so the muscles underneath of your bladder. And your prostate gland sits right underneath of your bladder, surrounds your urethra. You guys probably all know this, but this is just a review. And then you have sphincter muscles within the bladder. Okay. Causes of urinary incontinence. So there are many causes, but one of the main causes in men that you'll find is central nervous system. Anything that damages that nerve interaction between the brain and the bladder can cause urinary incontinence. So in the later stages, diabetes, stroke, Parkinson's, and vascular disease. Examples. Prostate enlargement can cause urinary incontinence. Treatment for prostate cancer, radiation or surgery. More so in women, but it can happen in men. Constipation, overweight and obesity, and urinary tract infections can all cause urinary incontinence. Okay. So actually go back. The arrow up. Here.
Sorry.
No worries.
Oh, they're right in front of my nose.
Yeah. Okay, so back to this. Sorry, it's a very quick point. But we're going to talk about prostate enlargement and treatment of prostate cancer primarily in this discussion. I'm not going to really get into any of the other ones. Okay. So as we move forward, prostate enlargement. Benign prostatic hyperplasia. BPH is the acronym for that. It's not cancerous, but it is an enlargement of the prostate as the man ages. It results in changes with urination. So you can have hesitancy, interrupted weak stream, urgency and leaking or dribbling, and more frequent urination, especially at night. So prostate enlargement due to prostate cancer. So enlargement of prostate due to the cancerous cells. Okay. Signs and symptoms. Initially, they're the same as what you would see with BPH. Hesitancy, interrupted weak stream, urgency and leaking or dribbling, more frequent urination, especially at night. Okay, so if we look at the treatment of cancer of the prostate, and this is, I did a literature search. I'm just going to go into these briefly and relate how these treatments relate to urinary incontinence. Okay, so we've got watchful waiting, radiation, hormonal therapy, chemotherapy, and then prostatectomy. So if we think about watchful waiting, you've been diagnosed with prostate cancer, and the treatment that you and your physician and the healthcare team have determined which is best for you is watchful waiting. So generally you don't experience a lot of symptoms with watchful waiting until the prostate grows large enough to cause problems. If it starts to get big, then you may have the hesitancy, the interrupted, the weak stream, urine stream, the urgency and the leaking or the dribbling, and the more frequent urination, especially at night. And those are things that you will talk with your physician about if you start to experience these symptoms. So radiation, there's two types of the radiation treatment for prostate cancer. You can get an external beam radiation or an internal radiation therapy. With the external beam, the radiation is like an X-ray, and it's directed at the prostate externally, and its radiation is given. With the internal radiation seed therapy, or I guess it's called brachytherapy also, they inject radioactive pellets into the tumor within the prostate gland. This is a repeatable thing, happens more than once. The internal radiation therapy is usually a one-time procedure. Surgical procedure. Generally, radiation therapy does not cause urinary incontinence. So it's more likely you're going to experience painful urination post-procedure, frequency or burning, urinary retention. But urinary incontinence, the leakage, it's not a symptom usually of radiation. Hormone and chemotherapy, same thing. Hormone therapy and chemotherapy, internal treatments, urinary incontinence is generally not a side effect of these. However, radical prostatectomy does have a side effect of urinary incontinence. So you can have surgery in one of three ways: radical retropubic prostatectomy, radical perineal prostatectomy, laparoscopic, or the laparoscopic robotic procedure. Just saying these words, hey, it's tough. But the retropubic is they do an incision from your belly button down to your pubic bone, and they go in and they remove your prostate that way. The perineal is they go between your legs, they do the incision, they go in and they remove the prostate gland that way. The laparoscopic is they do 3 little puncture holes, and they go in and they remove the prostate through these little puncture holes, and they can use a robotic machine to do that, or they can do it manually. This is kind of important because the how you prepare for these surgeries and the amount of urinary incontinence is important when we talk about that, okay? So a common problem experienced post-procedure is urinary incontinence. So it's related to when you manipulate the bladder and the urethra during the surgery. And also post-surgery you can have weakened pelvic floor muscles, which also can cause stress incontinence. For most men though, positive thing, the urinary incontinence is a temporary problem that only lasts 3 to 6 months post-surgery. Okay. So this is just a picture of the prostate removal process. So here, these darkened circles or gland, that's the prostate gland. And if you think about your anatomy, you have 2 kidneys, right and left. The kidney goes down to the bladder through, the urine flows from the kidney into the bladder by what's called a ureter. The bladder is a storage device. It stores the urine. Urine then comes out the urethra and out of the body. The prostate gland is underneath the bladder but surrounds the urethra. So when they go in and they do surgery, they remove the prostate gland, but they also remove or cut a portion of the urethra. Okay? So when you think about healing, you have to heal that portion of the urethra that's been reconnected. Okay? So that's before, and this is after. All right. So if you're going to have urinary incontinence due to the surgery or a procedure or BPH, understand it really is a treatable problem. It may not be cured, but it is a treatable problem. Consult with your family doctor or your specialist on all symptoms that you're experiencing, because your healthcare team really are the ones who are going to develop the plan of how you're going to treat this. No single treatment works for everyone. Treatment plans are individual, and it depends on the following: the severity of the problem, your lifestyle, and your preferences. Okay? And then you always start with the simplest treatment plan, and that's what all healthcare professionals try to do. So next slide. I'm just going to go through these 5 categories. We'll talk about what's in each category, and then we can go through a bit about the Dribble Stop in my company and then answer questions. Okay? So if we look at dietary habits, so the simplest treatment possible: dietary habits, behavior modifications, pharmaceuticals, incontinence devices, and incontinence products. Again, your healthcare professional will determine what's best for you, with you. But let's get into some of these. And I just really surveyed the literature to look at what was the most relevant pieces of information related to these categories. And we may, as a group, have some really good suggestions to add to this. So dietary habits. For urinary incontinence, again, decreased caffeine and alcohol intake is a diuretic effect. So if you drink a lot of caffeinated beverages, makes you pee more. So that could exacerbate urinary incontinence. So they recommend that you decrease these substances. Drink lots of fluids. So there is a misconception, well, it's not even really a misconception. If you don't drink much, you don't pee much. However, the bladder really likes to be flushed. It's the most happiest and the healthiest when you're flushing it constantly with fluids. So the recommendation is 8 glasses of water a day. Okay? You may want to look at, though, when you drink that fluid, you don't want to drink a liter of water before you go to bed. Okay? Could cause some problems throughout the night. High fiber diet prevents constipation. And then again, heart healthy. I'm not going to get into all the different foods that, you know, fight cancer, but a heart-healthy diet is a prostate-healthy diet. Behavior modifications. So Kegel exercises, pelvic floor exercises to help strengthen the bladder, or the pelvic floor to support your bladder. Doing these pre-surgery is probably very important. Your physician will discuss that with you, but what it'll do is it'll help support your bladder post-surgery, okay? Bladder training. Now this may be something that happens post-surgery where you need to, your bladder, when it gets manipulated, so you've had surgery and they've, you know, moved things around in there, they've manipulated your bladder, they've taken your urethra and they've cut it, and they've pulled out your prostate. That's a lot of manipulation to tissue in our body. So your bladder may be a little overactive. It might not be controlling its urination as well as it should be. So you might go through bladder training where they work to stretch your bladder to hold more urine so that you don't go as frequently to the bathroom. And basically the outcome of that is an increased bladder control, less urinary incontinence. Pharmaceuticals. There's many medications, to my understanding, that will help with bladder incontinence. And again, your physician can help you determine which one's best for you, if that's the appropriate treatment. Incontinence devices. So urinary catheters. There may be points where you need to self-catheterize yourself to get your urine out if the obstruction is severe enough. Definitely after surgery, you will have a urinary catheter in place anywhere from 3 to 10 days. That's kind of what the literature suggests. Generally, that's not something you would use all the time, though. You don't walk around with a urinary catheter. However, clamps. There are bladder clamps, or clamps that will help with urinary incontinence. And Henry, if you can discuss your product, the Dribble Stop, for us.
Want to do it now?
Yeah.
I don't know if everybody knows me here. I'm now known as Mr. Dribblestop. And I guess that name is going to stick with me. Hi, George. Anyway, I invented the Dribblestop because I had a urinary, lost control of my urine when after prior surgery. And as I got older, it got worse. And I had bought a clamp that was recommended by my doctor, and I tried it for 30 days. It wrapped around like a hose clamp, and I kept losing lots of blood circulation. And I knew what was wrong, and being an innovative guy, I developed a clamp that only puts, can you hold this for a minute? I made a clamp. Yeah.
He's got it.
It only puts pressure top and bottom. The side is loose for blood circulation. I've never had one guy complain yet about loss of blood circulation. And it's adjustable. You can, I've got different size links. These are the small links. You can get smaller, bigger ones. And it's easy to adjust. And once you have it adjusted, you know exactly where you're at. You're going to be guessing, like the one that I had bought, it had Velcro on. You never knew whether it was tight enough, or it was sometimes too loose and sometimes too tight. Never right. Anyway, I had to quit golfing and dancing. I couldn't do anything anymore until I got this. Now I restored my whole lifestyle with this clamp. I can do anything now. And if anybody would like to ask some questions, I'm glad to answer them. I'm selling them around the world, and this year my foreign sales have exceeded the Canadian and the US sales. I'm selling more now in foreign countries than I am in Canada and the US. That started this year. Can you hear me out? That's good. So if there's anybody who wants to ask some questions, I'll be glad to answer them.
What's the price on them?
They're $90 for you get 2 clamps. Some guys say that, boy, that's expensive. But there's some guys that spend more than $90 a month just on pads. This thing will last you a year. The average life is a year for $90. Nobody got any questions? I got lots of answers.
Don has one there for you. Right there.
Henry, I just want to give you a little plug. A friend of mine didn't have prostate cancer, but he had an enlarged prostate, and he got to the point where he wouldn't even go out. He wouldn't go out for dinner with anybody. He wouldn't go out for lunch. It was just a terrible situation. He is absolutely the last guy in the world you would think that would try the clamp. When I sent them to him, and he said it just changed his life. He is so pleased with what's happened. He's got a normal life back, which was destroyed before. And he's extremely happy. He's been back to Henry a couple of times now for replacements. But he said it's the best thing that ever happened to him.
Well, I'll tell you what. You don't know what it's like until you experience it. You go to visit somebody. You can't even go out and visit anybody.
Right.
Your pad gets full and you have to go to the washroom, and then when you get there, now what do I do with this thing? I've had guys come to my house and carry a diaper pack. With this thing, you don't have to. You carry your spare one with you, and I'm telling you, until you experience it, you don't know what it's like. You can't do anything, you're confined to home. 2 years ago, I made a trip up to Edmonton. I drove non-stop. I had the clamp on, and I didn't have to look for a washroom until I got there.
I can't even do that. Yeah. I can't even do that.
You can't.
He's making clamps for women next.
Yeah. Okay. There's a question at the back there, Henry.
Henry and I have been friends now for about, what, 4 or 5 years, Henry?
Yeah.
I'm wearing one right now. I'm not quite young enough to be his son, but damn close to it. How I got involved with Henry and his device. Dr. Donnelly, the urologist, my procedure was brachytherapy. It was 05 in the spring. And it was a year later that my incontinence problem began. It was fine for a year or so. And of course I didn't know what to do. Went to the urologist and everything. They wanted to implant surgically a valve. I didn't want that. That didn't sound too good to me. So I went to Dr. Donnelly was one of the urologists, 3 of them, by the way. And he gave me Henry's business card. He said, about the only thing I can recommend is to talk to Mr. Rennick. So I phoned Henry, and one thing led to another, and it took me almost a year to get used to this thing. It sounded kind of hokey to me. And I wear one every day, all the time, not at night. I seem to be okay at night for some reason. I guess the pressure's off, laying down. It wakes me up. I have to go to the bathroom anywhere from 1 to 5 times a night. But I don't wear anything at night. All day, every day, I swear by Henry's clamp. Good to see you tonight, Henry.
Henry.
One.
Henry. I don't think you remember me. My name's Tom Schindrook. You and I went to Lethbridge together several years ago.
Yeah, I remember.
Okay, I went to speak for Cancer Connection Group.
Yeah.
And we went there, and I've got 2 clamps from Henry. I don't use them all the time, but they definitely work. So I want to thank you very much for that invention. I think it's made a big difference in my life.
Well, I've changed a lot of lives. I've got a file at home. It's about 1 inch thick, full of compliment to the letter thanking me for inventing this clamp and how it has completely changed their lifestyle. It's not nice to have something like that, but it's sure nice to have some kind of control over it. That's the most important thing.
Henry, how do you know whether you're small, medium, or large? Do you help determine the size?
You'll have to come outside with me, I can tell you. Well, I'll tell you something. There's a lot of different sizes. I got a patient in Chicago. My clamp wouldn't work for him. I had to make a special one for him. I had to make it 3 times as big as mine. But it worked. Believe it or not.
So if anyone has more questions for Henry after the meeting, please come up and grab it and ask questions.
I'd be glad to answer them. I've got lots of answers. And I have a lot of urologists across the states and around the world that are sending patients to me now. And the word of mouth it's really has taken over the advertising. When I get phone calls, I do a lot of direct selling for people. Individuals phone me and usually ask them where they're phoning from and what their problems are, and we usually always make a deal. It's amazing. It's unbelievable almost of the interest that I have created in this clamp. And I'm not even scratching the surface, I know that. So, well, thanks for listening, and I'll give you the mic back to, what's your name?
Excellent. I'd like to add one thing to what I had to say. Henry makes just about the best wine in Calgary, by the way. I just thought I'd throw that in.
You need to sell it on your website.
I don't have a problem.
You get a bottle with every clamp.
Okay, so other incontinence products, not the clamp, and probably not as pleased to use them, but this is something that, I mean, we can use pads, the male guards, which really just insert on the front of your underwear. And like Henry said, I mean, it depends on the level of incontinence that you have, how much you're going to use, how thick you're going to need, all of that sort of stuff. There are briefs and protective underwear, which are more like pull-ups. And again, it depends on your incontinence. Generally, I think male guards seem to meet most of the needs. However, if there is a lot of leakage, you either have to change them a lot, or, you know, like Henry described, you can't make it up to Edmonton in a 3-hour trip. So other things may be required. Underpads are just a sheet-like underpad that can go underneath yourself in the bed, or can go under a chair if there's accidents, those sorts of things. Protects your furniture. Washcloths are just for hands. There's creams. Skin protectants, cleansers, and moisturizers. So important here, urine can to the skin, and if you're finding that you're having skin breakdown, you may want to consider a skin protectant. And what it is just a barrier between yourself and the urine to help preserve the skin integrity. Also with that, when you do get radiation, the external beam radiation, that beam being aimed at your prostate gland can cause skin breakdown over the long term. So really discuss that with your healthcare professional. What's a good cream or barrier to help prevent skin breakdown or to help heal it if that's to happen. Okay, so next slide. So it does get better. Urinary incontinence is a treatable problem. Consult your physician, talk with Henry, talk with folks like myself. I don't sell the Dribble Stop, but I do sell pads and briefs and other incontinence products. I think I'm going to have to start selling the Dribble Stop, though. Sounds like it really works. Also, the post-prostatectomy, be patient. Urinary incontinence will improve within 3 to 6 months in most men, okay? So just keep at it, keep hopeful. It does improve. The goal is really to manage the periods of incontinence and to maintain your quality of life during those periods. So as Henry said, you want to be able to go golfing, you want to go to a restaurant, you want to go to a movie. And how can you best achieve that? So that really is the goal. It's getting quality of life when we have these issues. Okay? So how can we help? My company is called Shasta Online Products. Me and my husband, we opened this company about a year ago, selling medical products online. Our first storefront launched is the incontinence products. We currently sell Prevail and Avail products. You can order them on the website itself, or there's telephone ordering. You don't need to get products from a store because you can order them online. We ship directly to your door. It's free shipping. We do bulk product discounts, and again, registered nurse advice is myself, and there's repeat ordering available. There's information back there, pamphlets and Prevail product guides for you to look at the end of the presentation. We sell products for youth, women, men, anybody who's experiencing incontinence. We also do have an excellent line of creams. We use the Swing products, which is a hospital quality product made by Coloplast. Okay. Questions?
You said the same nerve controls the urinary urge as controls the sphincter?
Well, it's a...
The question was, does that mean if you have urinary incontinence, you can also expect to have bowel incontinence?
No. Different sphincter. So there's a tract of nerves that will run between the bladder and the brain that go up from the bladder to the brain, and then there's a tract of nerves that will run down. And essentially, they're different than your bowel. Yeah, so you won't experience, I mean, if you have damage to bowel nerves, then yeah, you may have some fecal incontinence, but generally, urinary incontinence is its own thing. Yeah.
I don't have a question, but I think there's something that we all have to recognize, that between the fecal incontinence and the urinary incontinence, there is a certain connection. There's two connections that I can think of. One is with respect to the nerves. Once you release one, there's a tendency to release the other. It's remarkable, just observe. However, the main point that I want to make is that in many cases we have the urge, urinary urge, as a result of gas in the rectum and the colon. And that gas comes from lack of proper digestion in most cases. And so there's a couple of other professionals that enter the picture. One would be a dietitian, and the other is a naturopath, who, if you're passing quite a bit of gas or accumulating quite a bit of gas in the rectum, which presses on the bladder, then you naturally leak. And if you can get rid of that gas by proper nutrition principles and following them, then it will solve a lot of urinary incontinence for many people.
Mm-hmm. I think we can't underestimate the high fiber in our diet, the increased fluids to help your bowels move properly, and the impact it does have. Constipation can have a huge impact on urinary incontinence, yeah. All right. Thank you, everyone.